So good morning, everyone. My name is Shazia Khan, and today's learning outcome we'll be doing is learning outcome 2. Before we go into learning outcome 2, I'm going to just give you a summary of what we did in the last session, which was learning outcome 1. We looked at understanding the role and research and different approaches in health and social care. And we also looked at, the element of what evidence-based learning is in regards to researching, why it's so important for health and social care. We looked at the well-being of individuals, guidance, protocol, and policies. We also looked at data collection. We looked at the importance of research in health and social care. Can anyone remember why it's so important to have research in health and social care?
To improve the lives of the service users and the staff.
Yes. So, and also, Addy, would it be things like diagnosing diseases earlier and things?
Yes.
Yeah. So to improve lives and diagnose earlier diseases earlier and things, we looked at the what research skills are and why they're so important. And we looked at different types of research in regards to academic research as well. So what you would do when you are students and how you absorb things. So we looked at elements of how research is conducted and why it's conducted in learning outcome 1. We looked at the different types of research and we referred to the main two, which was qualitative research and quantitative research. We looked at qualitative research and what that involves, things like, one-to-one interviews, face-to-face interviews, focus groups, case studies, things like that. And then we looked at quantitative data, which is things like surveys. So when you'd send out a survey, and that could involve things like descriptive research as well and correlational research. We also looked at the 8 tips for conducting research. And we looked at elements of what is research in health and social care. It's things like, providing life-changing treatments. If anyone's got Alzheimer's or anything like that, we try to ensure that people have a better quality of life. If anyone's towards the end of their life, they provide end-of-life care. We looked at examples such as like breast cancer and maybe the comparison between 2 drugs, how that would clinically trials, making sure that new drugs are helping certain things. Maybe there may be a drug for Alzheimer's, try to slow it down. So they would do clinical trials to make sure that that drug works before it's implemented into the public and make sure that, if there's any patients, that it is the right drug that's going out. Clinical trials are, really important to try and identify if that drug or medication is actually working. We also looked at how a research contributes to our NHS, why it's so important to have research in place, and the importance of implementing research within the NHS and how it would impact on future. It could be things like introducing new medication. It could be the introduction of new things like, the equipment as well, new equipment, whether it works or not. People need to be trained on these equipments. So we looked at elements of that, and there was also some video you could watch towards the end. So that was on learning outcome 1. Has anyone got any questions on learning outcome 1? No, is everyone okay? So we'll go on to learning outcome 2. And learning outcome 2 is primarily based around an assignment area that you've got to do on research as well. So it looks at how to identify and justify a topic for research within services for health and social care. So it looks at elements of, trying to identify what you want to do for your research as well. So undertaking a research is really important, and there are elements of that need to be identified. So learning outcome 2, the indicative content that you'll be looking at is considering the potential impact of research using evidence-based practice, identifying potential participants of samples, ethical considerations, why aims and objectives are so important, which we'll look at today as well, permissions and approvals, consent, confidentiality, anonymity, and understanding research, the purpose, aims, and objectives. The time management is really important. When you do some sort of research, you need to make sure that, you put in the right things in as well, and making sure that you're identifying through the research what your main aim and objective is. Key terminology, what is the importance of research in health and social care? And we did look at this yesterday as well in Learning Outcome 1. It was there to look at things like, diagnosing people. The main part of it is to underpin any sort of new advancements, and it improves, patients' outcomes. Any sort of research is crucial for any health and social care setting. It could be how could research, why is it so important for staff members then? Why do you think research is so important for staff? Udu, why do you think research is so important for staff members?
To gain more knowledge.
Knowledge of what? Anyone? Deborah?
Yeah, to gain more knowledge.
Gain more knowledge about what? What kind of things?
To carry out their tasks properly.
Sorry?
I said to carry out their
Yeah,
tasks properly.
yeah. So could it be equipment, Deborah?
Yes.
It could be equipment. It might be policies and procedures that they want to put in place. So making sure they're informing people of any sort of new policies or anything. So staff will be involved in that. It could be, that they try to look at new treatments, new approaches that can be used to help patients and things. It may be trying to understand the local population. Maybe look at targeting people with diabetes in one area and how you can prevent that. So these, research is really important in health and social care because it's there to identify and improve people's life. So there is something there that on slide 4 that you can look at in your own time. This video. And then we go on to agree in a topic. So 2.1, here you have to agree a topic for your research, okay? So you will have that form. It's a research proposal. You would need to complete that as part of your task, which we'll go through, and that would identify to you. I'll just increase the screen of that a little bit. So that identifies to you, it's an example of the task. So what is your role within the organization and how are you going to link this to your proposal? It could be an introduction, the title someone's put here, what makes us healthy? That's their introduction. And here you could look at what you plan to do, and then your aims and objectives on the next one. And objectives, why is it good? Why is good health important? What influences and the purpose of your research? So you need to fill this out as your proposal, okay? This will be part of the task that you do in your assignment, okay? Also, there's a link here where you can look at templates for proposals. Let's see if I can open that link. So that link's not right. Maybe the link below. So this looks at different research proposals as well that you could go on to. It's not working at the moment. So have a look at that when you go into it in your own time, okay? So these are research proposal templates and it's examples as well. So let me just reduce the size of this. So evidence learning, and this is something that is happening quite a lot, and it's a process where an approach to decision making that integrates the best available research evidence with clinical expertise and patients, methods, and optimize patient care. So the whole emphasis of this evidence-based practice is it's there to prove methods and information on informed decisions rather than relying on intuition. So it's a good way of using evidence-based learning. It's the whole point of evidence-based learning is it's a framework that empowers healthcare professionals, which it could be doctors, nurses, clinical practice, to make informed decisions that are both effective and tailored to the individual needs. So that's what they will do around evidence-based learning. And they need to get this evidence to come up with something that makes sense to them. So how do I get evidence-based learning? So in place, you'd get involved in, you should start by learning the fundamental steps, asking a focused question, finding relevant evidence, making sure you're integrating with other clinical expertise, your patient preferences, implementing findings, evaluating outcomes. So you need evidence. Why do you think it's important to have evidence to prove something? Why do you think you need to go through the steps of, finding evidence, critical appraisal, evaluation, getting in touch with patients? Why do you think it's so important? Would it be easy just to get this information like that? Boma?
For future reference.
Yeah, for future reference, but to get this evidence, would you need to interview people and, talk to people and get this evidence from them?
Yes.
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 Because the data will come from them, so you need to get them involved. You need to make sure that, you carry out the proper steps to get that. And you need to encourage.
Questionnaire.
Sorry?
Questionnaire.
Yeah, questionnaires. Yeah.
Yes.
You need to get that evidence-based learning to make sure you come out with the exact thing at the end of it.
Yeah.
So the next one is looking at ethical considerations. Now, why is ethics so important? Why is ethical consideration so important? When we talk about ethics, what does it mean to you? What is ethics?
Like the rules and regulations you should follow.
Yeah, that's what you think of it. Yeah, what is ethics to you, Catherine? What does ethics mean to you? What's ethics? What do you think when someone talks about ethics? What is the first thing that comes to mind for you? Boma was
Like a
right.
positive relationship.
Yeah. It could be anything. It could mean anything for anyone, but it's mainly a set of principles that include things like getting consent, making sure that you're ensuring confidentiality and avoiding any sort of deception. Confidentiality, anonymity, people might want you to participate, but then, they may want you not to tell them who's done it. When you look at participating in research, some of the people that you ask questions or get them to participate may not want their name to be involved. So it's really important that you are prepared to ensure any sort of confidentiality for them and make sure that everything is you've got their consent as well, and they have a clear understanding of what you're doing. Because you can't just say, I'm going to research this and I'll ask this person. Why do some people not want to mention their name or anything if they want to be confidential? Some people may want to remain confidential when you're doing a research. Why is that?
Because they want their privacy.
Yeah. And you should respect that, shouldn't you?
Yeah.
You should respect that, and you should do the research based on, getting consent from them, and being confidential about what's going to happen. Because some people will not want that, when you're working with vulnerable people as well, you should get consent from them. because, you know, if you're getting them involved in any sort of research, they need to know what's happening there. So protecting their confidentiality means keeping their personal information private, and, you know, helping them also deception. You know, they can be misled as well if they're vulnerable. So, you know, you should respect for people. You should be objective and have integrity, be transparent as well, openness and transparency. And you need to be referring to ethical principles to ensure that the work that you research is conducted responsibly and properly as well. You can't just say to people, oh, we're going to use you, and then not bring in all these elements of ethics as well. So developing a timeline for your research, you know, it's really important to have a timeline in place to make sure there's a chronology of events so that you plan your research. Why is timeline so important? Why do you think a timeline is so important when you're doing some research? So if you're doing some research and you have a timeline of chronology in place, 2001, 2002, 2003, why do you think it's so important?
Does it keep you organized?
Yes, it keeps you organized, but it also,
And to
you
put you in check.
yes, in check, because you know when the historical events happen. So, you know, it helps you demonstrate competence, but also it shows you a clear vision of what you're going to do at the end of the report. You know, if you have something in chronological order, you know, it shows you what aspects of that research you're going to consider, and what resources are available, and what the data is. And the data, it could be chronological order of when the events occurred. You know, so it's like a milestone. And it's really, really important when you're doing something like that to have all the events in, you know, in a chronological order. So, you know, it has this element of chronology of events and in order as well. And you've got so an example of timeline. Okay, so this is in this graph here, it shows you an example of a timeline. So you've got timeline Jane Husky, you've got the total project hours, 350 hours, work week, Monday to Friday, 9 till 5, 35 hours for 10 weeks. I will have weekly meetings with my advisor to track progress and troubleshoot any major issues. And I will also be consulting regularly with graduate students in the lab working in the related projects. And each week she's got week 1, week 2, week 3, week 4, week 5, week 6, week 7, week 8, week 9, week 10. And she's got it in chronological order with the dates and the hours as well. And then she's got the what task description she's done in that. So in the first time, she's looked at trading on new microscope. Then in the second one, so week 2, she's looked at categorizing samples using X-ray diffraction. Then in the third week, she's repeated the optimal synthesis. In the fourth week, she's synthesized samples. In the fifth week, she's categorized the new samples. In the sixth week, she's doped samples with a combination of iron, copper, and nickel. And then she's been on vacation. And the 7th week, she's categorized the new samples. The 8th week, she's synthesized best samples. And then in the 9th week, she's categorized the new samples. And then finally, she's prepared a summary data analysis and description of optimized. So she's looked at this and she's looked at how to draft each one and make sure she's made sure that she's looked at what she's doing chronologically. So that makes sense to her working on the research, and the person reading it, it makes sense to them. So it's quite a good example to have a look at in regards to that. So presenting potential evidence-based practices. So you've got assess, evaluate, ask, apply, and acquire. So these are elements that are used in regards to evidence-based learning. So you need to be looking at elements of these. So it could be things like, you know, the element of, you know, assessing something. making sure you assess something, making sure that you then, when you look at assessing something, making sure that you ask and evaluate that thing, and then you apply it and acquire it. So these are things like presenting the element of evidence-based learning and why it's needed. And it's there really to make informed decisions that improve patients' outcomes. This is all about improving patient outcomes, the quality of care you provide, and optimizing and utilization. So it's really important, evidence-based learning, because when you go through it properly, then you identify what's coming out of it. Explain the importance, 2.2, explain the importance of aims and objectives. So, research aims describe the purpose of the main goal. Why is it important to have research aims? Why is it important to have research aims? Why do you think it's so important to have aims and objectives? What is an aim?
To know the core values of the study,
Yeah,
the importance,
okay.
and to elaborate more what the topic or what the research is all about.
Yes. So if you're Adi, if you're talking about example, you're talking about staff innovation, okay?
Yes,
You need to identify in your aim, in the statement, that you're outlining the goal and the purpose of your research project. If you're
yes,
just saying you're talking about staff innovation and then you start talking about dementia, that's not really identifying that you're talking about that. Your aim is a statement that outlines the overarching goal or purpose of your research project. So
yeah.
it's the main thing that you hope to achieve when you research.
Yeah, that's why I said the core value for the
Yes.
research.
So it will be the main thing at the
Yes,
start that you aim to achieve. When you say, this is what I'm going to do in my research, and then you talk about something else, you're not really looking at your research aims, are you? So it's a statement that identifies what you intend to do, how you, sorry, it's through how you're going to do it through your research, and it should be communicated to the audience. So the audience being myself, anyone else who's reading everything. Okay. So if
yes,
someone is reading your work and you don't put a clear research aim, they're not going to know what you're doing. So you need to make sure it's a clear statement, and it's a general statement, and it captures the main purpose of the research, and there's a focal point on there. So for example, you could say that, I'm going to look at the development of the research for cancer or something like that, or I'm going to look at the healthcare profession after COVID or before COVID, so you need to be looking at it, and the whole point of it, it directs the reader. So it needs to be clear and focused, so the reader is able to understand what you're able to do. So it could be that one of your research aim could be that you want to investigate the relationship between social media usage and academic performance. So it's an example. It's looking at what you intend to do. Why do you think the aim has to be clear? Why do you think the aim has to be clear?
so that it will be coherent.
Yeah, yeah. So, it could be things like, if you're looking at health and social care prevention, it could be to investigate the effectiveness of a new drug, reducing the symptoms of arthritis or Alzheimer's. So it's looking at the overall impact. So the aim is there to identify, what you want to achieve. Is everyone okay with the aim?
Yes.
Yes. What are your research objectives? So when you look at what your objectives are, what is meant by your research objective? Anyone? What are research objectives?
To find a lasting solution to a sickness or diseases.
Sorry?
To find a lasting solution to any sickness or
Yeah.
diseases. Yeah.
Would it look at things like your research objectives? Would you describing what your research intends to accomplish? At the end of your research objectives, what you need to do. So you need to be specific, accessible, obtainable, and relevant, and time-bound. So you'd use the SMART acronym here. So your research objectives are specific, measurable goals that you outline when you aim to achieve. So they guide you. They are there to guide you throughout the process. And it might be data collection, it might be a well-focused, well-defined study. So the purpose of objectives are to define you and give you that guide, so you've got a guide throughout what you're doing. So you are looking at ensuring clarity and direction. You have to know what your objectives are. So your aim is what you intend to do. Your objectives are what the research what it should be doing, where you're going with the research, what you intend to focus on when you're doing the research. Okay, and it looks at here, you will be looking at the SMART acronym, which is the first one is specific, then you've got objectives, should be clear and will be researched, where the research will measurable, that they'll be quantifiable, achievable. So objectives should be realistic. If you can't achieve something, then it's not realistic. Relevant, they should align with your overall research aim, and time-bound objectives should be achievable by a certain time frame. And these are the things you will be using when you are doing your research. Understand the difference between research objectives and aims. So aim is a goal or purpose of the study, while objectives are specific, measurable steps taken to achieve it. So the aim is broad and provides a general direction, where objectives are more concrete and define what you will be doing throughout the research. Do you understand that? So the aim is just a statement to say what you are doing. Then the objectives are the short-term ones, where you'll know throughout the research what you intend to do step by step. Is that okay, everyone? And
Yeah.
any questions?
Yeah.
Do you understand the difference between an aim and an objective?
Yeah.
Yeah. So an aim is like the overall purpose, what you intend to do, okay? And then the objective is how you intend to do it, what steps you intend to take into board the SMART acronym. Then we've got looking at 2.3, which is explaining ethical considerations that apply to the area of your research. Ethics is really important. Ethic considerations are principles that would guide your research, design, and practice, ensuring that participants' rights are protected, which we looked at a little bit earlier. It's a set of principles, confidentiality again, consent, and anonymity. If the person doesn't want to, be part of the research, as in their private information, then you would have to ethically understand what they want. So you'd need consent, you'd need to be confidential, protecting the privacy of the individual. You'd need to minimize any sort of harm as well. So if any harm would be to that individual as well, you have to be really, really careful when you're doing research and stuff. Why do you think ethics is a big part of any research? Why do you think it's so important, and it's so delicate as well? Why do you think ethics is so important? Why do you think if are you breaching something if you give a person's information, if they said don't give my information?
Yeah, you're like
Yeah.
breaking the agreement of
Yes.
confidentiality.
Yeah. And you're not taking into account any of the principles of ethicals,
Yeah.
conflict of interest, data protection, ethical violations, confidentiality, You know, these are things that must be considered when you are doing a research.
Minimizing harm.
Sorry?
Minimizing harm.
Yes. And minimizing harm is really important, isn't it, Gifty?
Yeah.
You know, you have a responsibility to make sure that, you know, you have careful consideration about any sort of data or anything, and not consider anyone, you know, anyone's getting harmed through that.
Yeah.
You know, because that's so important. It's a risk of harm to the individual. If you adhere to the principles of confidentiality, anonymity, informed consent, then you would be able to ensure that your work is conducted responsibly, and you know it's trustworthy and ethical, and you've taken all the principles into account. You know, because that's really important when doing a research project. And especially in health and social care, when you're looking at the element of harm in because you're protecting the safety of your volunteers who are volunteering in the research, you know, so you have to protect what they want, you know, them individuals. You know, you need to make sure that you're, you know, thinking about showing respect for that individual, you know, making sure that you're, you know, taking on board if you know, you have informed consent from that individual, you have confidentiality and anonymity that their personal information won't be given to anyone. You know, it's so important that you do this because, you know, ethics is a huge part of any sort of research. What are the ethical considerations in health and social care research? So, you know, especially in health and social care research, we still have to take into account that we're maintaining any sort of public trust in research and upholding any sort of dignity and rights of individuals involved in that study. We have to, it's crucial in health and social care that we are ensuring responsibility and we're being trustworthy. You know, key consent, we're taking consent, the participants that are involved have the right to make their own decisions about withdrawing from it at any time as well. Confidentiality, again, protecting participants' privacy is paramount to any sort of research. So it might be sensitive information that they don't want to, you know, find out anyone wants to their information to be out there. And researchers are responsible for minimizing potential harms, like Gifty said. And justice and fairness, research should be conducted in a way in health and social care that is fair and equitable, ensuring that benefits and burdens are distributed justly. And research must be scientifically open, sound, and conducted in integrity. And you know, it must be transparency and openness. So you know that there's no elements of scrutiny as well. You know, you have to be, if you're doing research, who is accountable for that research? Gifty, if you do some research, am I accountable or you're accountable? Sorry?
Me,
Yeah, you're accountable. Why are you accountable for that research?
because I know the details of what I'm doing.
Yes, you know the details. You've been told how to, you know, do things. You've been told how to align with the
Yeah,
principles.
the task and
Yes, you've been told how you need to take the ethical principles into account, you know,
yeah,
and research needs to be done. It needs to be done for, especially within health and social care,
yeah,
because, you know, we're looking at the quality of life, we're looking at ethical standards, we're looking at protecting the dignity, rights, and, you know, welfare of individuals that we get involved in the research. You know,
yeah.
you shouldn't be someone who says, "Oh, do this research for me," and then not be able to, you know, protect your individual's rights or anything. So make sure that, you know, you are taking that into account when you are doing any sort of research.
Okay.
So the next one is 2D WOD, analyze own SWOT current skills and analyze your own current skills and knowledge in being able to conduct a literature review in health and social care towards the evidence-based practice. And you have to do a SWOT analysis in the area of research. And there's a handout on Moodle. It's the handout 2D1 improvement and knowledge skills, and it's on Moodle as well. I'll see if I can show you that as well, if I can get onto showing you that. And here you will look at your SWOT analysis. Has anyone ever done a SWOT analysis? Your strengths, weakness, opportunities, and threats? No, no one ever done one. So this is an
No.
example. Sorry?
No.
You haven't. So this is an example of a SWOT analysis, okay? So you've got the S there, which is looking at identifying your strengths, okay? So what you do well, what makes you stand out from other competitors? What advantages do you have over businesses? So this is your strengths. Examples are things like you're hardworking, you're committed, you're competitive. These are your skills, okay? These are your strengths, okay? People don't like to talk about their strengths too much, but this is how you would do. Then you've got your weaknesses. So here you need to be, what do customers complain about? So there are weaknesses, lack of funding, it may be profit, it may be initiative systems, and then you have opportunities here. So list of all the possibilities that an organization pursue or exploit or gain benefit. So how do I identify the opportunities? Are there emerging trends out there that fit in with the company's strengths? Are there enough, what kind of messaging do we have? Which are the best opportunities? Example could be lack of competition, demand for your offerings, market growth, outlining your presence. It could be how do I identify the threats? That's the T from SWOT analysis. How do I identify threats? Things like new competitors. So a SWOT analysis is a strategic plan tool that is used to assess your strengths, your weaknesses, your opportunities, and threats related to a research project. So it could be, the strengths of, it might be help researchers understand things like, your internal and external factors that can influence a success or failure of your research. So you would have to do a SWOT analysis for your research, your strengths, your weaknesses, if it's, and if there will be strengths and weaknesses for everything, and where you're going to try and find out when you're doing your research analysis, where you're going to try and find out where your strengths and weaknesses are. There may be a strength where you can't find, you can't find research on a certain topic. It could be something, it may be, it may be that your strengths might be that you can find loads of research on a certain part, and then in some areas you won't be able to find anything. So, there are strengths and weaknesses, and you need to be able to do a SWOT analysis. So, it could be things like, I'll give you an example, a community-based mental health service. One of the strengths could be that there's experienced and skilled staff out there. There's strong communication connections, and there's specialized problems. One of your weaknesses may be that you've got limited funding. There's a high waiting list, lack of research dedicated capacity. One of your opportunities looking at mental health could be growing awareness of mental health, funding opportunities. One of your threats could be changes in commissioning practices, increasing competition. The whole point of doing a SWOT analysis is it can look at focusing on your area, what you're researching, and improving services. So, it's important to be realistic and honest about your strengths and weaknesses and your opportunities and threats as well. The SWOT analysis is they call it a living document, which can be reviewed every time and added on to. It could make you understand your position and inform decisions. So you need to be doing a SWOT analysis. I'm just going to see if I can find a SWOT analysis that I can show you in regards. That's one that I've got there. Let's have a look at this one. This is another one that I can show you here, which is looking at a SWOT analysis. And it looks at explaining what it is. So it's a planning document for you. But there was a picture of it here. Okay, so I'll just share this one with you. So can you see this? Maybe you can't. Let's have a look, share. There are examples of these on Moodle for you as well that you could have a look at in your own time. Why is it not going through? Okay, just 1 minute. Hello, can you hear me?
Yes, please.
Yeah. So let me just see if I can. I don't know what's wrong with this. Right, go on to that. Keeps going back. On Moodle, there is examples of SWOT analysis, okay, that you could go on to, that you could use as a template as well. Can you see this that I've brought up on the screen here? It should come up now, I think. No?
No.
So it's a SWOT analysis, which I'll
Yeah.
put, you can see it.
Yeah.
Yeah, so it's a SWOT analysis and it looks at your strengths, weaknesses, opportunities, and it's a matrix that everyone looks at, and its element is there to prove any sort of opportunities, any threats, any strengths and weaknesses. And sometimes employers do ask for a SWOT analysis as well that you could look at, you know, but make sure you have a look at that in your own time. But on Moodle, we've got templates on Moodle as well for you that you can have a look at. That will help you identify any sort of elements of that if you struggle with the SWOT analysis. Has anyone got any questions on the SWOT analysis? Just reduce the size a little bit on this one. So this is, you would have to do a SWOT analysis if you wanted to gain a distinction for your assignment area. And we'll look at more that, your assignment area towards the last session, okay? So you will have more of an idea. So this whole point that we've done today is about your research project. So come up with some ideas. There's some links on there that you could come up with some ideas that you may want to do research around. You know, some people I remember did the impact of COVID, you know, on and did research around that. You know, some people did it on a new medication. So it depends on what you want to do. Okay, so there are research links there that you could go on to that could help you towards it. So has anyone got any questions? Let me just see which part. Any questions, anyone?
No.
No.
What's the links for?
Sorry?
What the links for?
These links here are your references, okay? So these are the references we've used to do today's session that you can look at in your own time, okay?
Okay.
This one here on the next plenary is some important reading that you can do, and this is available on Moodle for you. So it's got further reading on the value, importance of health research and the evidence-based practice that you can link on there and have a look at in your own time. For the tasks, you know, when it comes to doing the tasks, you have a pass, merit and distinction. Now, when it comes to doing your work, you need to identify which one you want to do, and you have to do for the tasks a research project proposal that you need to identify and do presentations as well. So I will go through that with you. It's 4 tasks in your assignment, but a lot of the research is have a look at research areas that you want to consider. You have to put a research proposal, the template that I showed you in the slides that's available on Moodle for you. So that template will have your research proposal, what your title is, what your role is, what your aims and objectives are, what the purpose of the research is, what you intend to do. So you need to have a look at that research template and come up with some ideas that you may want to research. You know, have a look at them. It could be anything to do with maybe new medication. It could be COVID. It could be the impact of mental health. It could be anything, but it needs to be around health and social care. Okay, so have a look at some ideas. They're all on Moodle as well. Some links that you can go on to. And that's towards the end, we go through the assignment on the last session, assignment discussion. Okay, so just giving you a summary of what we've done in today's session. We've looked at the evidence-based learning. We've looked at research and how research is so important within health and social care. We looked at the potential impact of research. We looked at elements of how do we get involved in evidence-based learning, ethical issues, which are really important in any sort of research. We also looked at developing this timeline for research, why it's important to have a timeline for research. We looked at assessing the importance of the aims and objectives of research, why they're so important within health and social care. We looked at objectives, aims, the difference between them. We also looked at ethical considerations. And we also looked at the SWOT analysis towards the end, which is again available on Moodle for you. And we looked at analysing our own SWOT analysis in your. So when you do a SWOT analysis, it would be in your research area, and it's a distinction. Based question. So if you want to get a distinction, you would have to do a SWOT analysis. So the example on there is really beneficial for you to have a look at your skills and knowledge, but also there's other examples on Moodle, additional reading around that. Again, any queries, any questions, email learnerwork@ukvarsity.co.uk.
Sorry,
Yes.
yesterday you mentioned that if we want to get the recording for the class for yesterday and today, that you're
The
going
recordings you will get on Monday,
Oh, okay.
which are tomorrow, because
So it's
there's
going to be on our module.
Sorry, what's that, Adi?
I said, is it going to be on our module?
Yes, every unit that you do, there will be recordings for every unit, and they normally go up on the Monday, because no one's in the office on the weekend. So they will all go up on Monday. So yesterday's and today's recording will go up for you tomorrow. And if you're doing different units and you have different tutors, their recordings will also go up for that unit. Okay, so this recordings will only go for this unit. All the recordings will be up for you, okay? So if you need to listen to any of the recordings or go onto the links, they're all available on Moodle for you, okay?
Okay. All right,
Has
thank
anyone
you.
got any other questions? Boma, Gifty, anyone? Anyone? Catherine, any questions?
No.
Okay, so thank you.
Wait. Sorry.
Yeah.
What's the website to get the medals again?
To get the what?
The medals.
Moodle.
Yeah.
You should have access to Moodle. Do you not have access to Moodle?
No, because I've tried getting onto it.
You need to email learnerwork, then you need to email learnerwork@ukvarsity.co.uk if you're struggling to get onto Moodle, and if you're struggling to get any access to Moodle.
Okay.
And you need to do that today as well, so that they give you access for tomorrow, during the week.
Yeah.
Make sure you get access. So any queries, any questions, again, learnerwork@ukvarsity.co.uk.
Okay.
Okay. Thank you for attending today's session, everyone.
You're
Lovely meeting you.
Thank you.
Doopy.
Thank you.
Yeah.
Thank
Thank
you.
you. Thank
Bye.
you.
Thank you. And I will see you next week, Saturday at 11 o'clock.
All right.
Okay,
Bye.
take care. Bye.
Bye.